Well, good afternoon, everyone. It's good to be back with you today alongside our Minister for Health and Social Care. Through your efforts, we've reached the point where we can say, with as much certainty as possible, that we are COVID-19 free. It is a milestone of great importance, and you have got us there. But more on this in a second. Firstly, I will hand over to the Minister to bring us today's numbers, and I know he also wants to update us on dentistry. David.
Thank you, Chief Minister. The total number of tests undertaken now stands at 5,812. We are outstanding 28 results, which means the completed test stands at 5,784. The total confirmed cases remains at 336, so no new cases identified. Just before handing back to the Chief Minister, I would like to turn very briefly to dentistry. There has been some confusion as to the procedures allowed at dental surgeries following the relaxation of rules on social distancing. We have already said that they still apply in health and care settings. This is a temporary measure which will be reviewed at the end of next week. The department and the profession have spent some time designing how dentist surgeries would be able to reopen safely. We agreed that to start with, they will only carry out urgent treatments, not routine examinations just yet. The path we've agreed includes the use of PPE, hygiene and decontamination protocols, and social distancing measures, all of which is designed to protect staff and patients. Now, I know that many dental surgery receptionists have taken calls from patients keen to have their checkups as soon as possible. But all our dental practices, those with NHS patients and those operating entirely in the private sector, are taking this step by step. We will return to routine appointments in the next stage, and I ask people just to bear with us that little bit longer. Thank you, Chief Minister.
Okay, well, thank you very much, David. And today our island has broken through a significant barrier in our fight against this invisible enemy. A fight which has led to the tragic loss of 24 people within our community and caused suffering to so many. People have lost loved ones. Others have lost livelihoods. People have been under real personal pressures. This must never be forgotten. Yesterday we recorded our 28th day without a new case and went one further today. So why is this significant? It is significant because we are now more than double the 14 days widely considered to be the maximum incubation period of COVID-19. Thanks to your incredible efforts and sacrifices, we have reached the stage described as local elimination of the virus by our public health colleagues. As we near a full month without a new case, the likelihood of the virus circulating in our community is exceptionally low, and we are as close to 100% free as it is possible without a vaccine. For the moment, this is as good as it gets. This week, our island became the first place in the British Isles to remove social distancing. With this, we are handing the baton back to you to make sensible decisions to continue to protect yourself and your loved ones in this new Manx normal. From today, the final restrictions have been lifted within our valued hospitality and leisure industries. This means that this evening we can have a pint in our local or a dinner out with our family. Once again, you will now be able to enjoy trips to the theatre or marvel at the latest blockbuster in the cinema. For those who prefer push-ups to popcorn, gyms can open as normal, as can swimming pools. Our social fabric has been under huge amounts of strain over the last 12 weeks. I hope that today's changes will undoubtedly help stitch this back together again. This is a freedom that a few weeks ago we could only dream of. Altogether, darker scenarios were possible. And now, through your efforts, it is a reality. We encourage you to embrace this freedom and support local businesses who have been unable to function normally during this pandemic. Our local businesses play such an important role in our economy, and they need our support now. As our economy gears back up, so will our schools. School staff have now returned, classrooms are being prepared, and yesterday children of key workers who have been attending 14 educational hubs since March went back to their normal schools. Yesterday, the Minister for Education, Sport and Culture was able to confirm that all children who wish to will be able to return to full-time education on Monday. I'm sure that this will be welcome news for parents and hopefully children. Things are starting to feel normal again, and I would like to thank parents and children for their patience. I wish you all well as you embark on this new chapter. I would like to thank the school leadership and their trade union representatives for working with us to get our children back into their classrooms, to reclaim at least some of this term. So with schools back next week and our economy reopening, I hope that we can now return to living life as normally as possible. I know that for some people this is not going to be straightforward. I know that there has been a lot of anxiety in our society and a certain amount of fear. I know that switching between the stressful times we have lived over the last 3 months and a more optimistic future is far easier said than done. Some of us will need time to adjust. Some of us will need support. There are a number of good resources out there to help. Our COVID website has some great videos and links to a range to help available for adults and children, such as Quayle and Quayle. If you found the last 3 months tough, please go and see for yourself. As with so much of our dealing with COVID in our community, we all have a role to play. As individuals, we need to be kind and supportive to each other. We have all lived different experiences through this. Some people will feel the need to maintain some physical distance from others. We need to respect this. To this end, the Samaritans will join us at our briefing tomorrow to discuss some of the issues people are experiencing. This government is listening. We know that there will be an increased demand for support as we exit this pandemic. We are gearing up for this. Employers have a role to play in all of this. As staff come back to the workplace, some will find it easy, some less so. Please do everything you can to support them. Our community spirit has been amazing throughout, and I know this will continue. Some of the anxiety in our community, I'm sure, stems from the concern that we may not have seen the last of COVID on our island. And yes, we may see other cases. We cannot rule this out. This week we saw what happened to our friends in New Zealand. We have all been so impressed with the way they have managed the virus, and I still am. It is not a sign of failure, but is a timely reminder that we must remain vigilant and ready to act swiftly should new cases present themselves on our shores. It also reminds us that we need to be incredibly cautious when considering any future changes to our border controls and the importance of 14-day home quarantine. As I've mentioned before, if we do see the same thing happening here, we will be ready. We have testing and contact tracing ready to go. This will enable us to break the chain if we do see new cases. But I urge all businesses to stay prepared. We need you to be ready to tackle an outbreak if it happens. And of course, if any of us develop any kind of COVID-19 symptoms, a loss of smell, a loss of taste, a fever or a sustained cough, we need to stay at home and call the community help and advice line 111. So what comes next on our journey? Last Monday I talked to you about the final measures that remain in place. This Monday coming, the 22nd of June, the temporary 60 miles per hour speed limit will be lifted and we will return to our pre-COVID situation. Once this is done, I hope to be in a position where I can invite the Lieutenant Governor to lift the state of emergency. Our aim is to be able to do this by about the 23rd of June. The Emergency Powers Act was used to help to protect the population against the spread of coronavirus. It gave the government greater flexibility through strengthened legal powers. The decision to invoke these powers was not taken lightly, but was a necessary evil in this extraordinary and unprecedented time in the island's history. And that just leaves our borders. The continued closure of our borders is ultimately what is allowing us to open up our society. We have created a Manx bubble where our schools have been able to open, our economy is able to gear up, and we are able to hug our loved ones once again. We are keeping a close eye on what appears to be a steady, improving situation in the United Kingdom and many other countries, and the Council of Ministers will discuss borders formally towards the end of June. To be clear, we are not ready to open the border. The excellent position we find ourselves in cannot be undermined at any cost. I will not put our nation's health and well-being at risk. The Health and Social Care Minister and I are happy to take questions now, and first today is Amanda Cashmore from Jeff the Mongoose. Good afternoon, Amanda.
Good afternoon, Chief Minister. I know you're not able to give any dates or make any promises yet, but many people are worried about any changes to borders, as I'm sure you're aware. Can you put their minds at rest and explain to them what the rough plan is with borders, irrespective of dates?
Well, I think it'll be a staged approach, Amanda. We're not going to suddenly wake up and see me announce that all the borders have gone and people can just come and go whenever they want. I think the first changes, the first stages we will be looking at will be making it easier for locals to leave the island and then come back. And obviously we will take the advice of our medics to see how we can come up with a safe, secure system. But one of the reasons we can do that is the 14-day quarantine at home is the main protection against it spreading. That's what's happened. We have had a couple of people who've come from the United Kingdom, locals who've gone away, whether it be for medical or key workers, etc., who've come back with the coronavirus. But because of the 14-day quarantine, no one caught it as a result of that. So that is the key element. I've been in negotiations with my good friend, the Chief Minister of Guernsey, who are in exactly the same excellent position as ourselves, to see if we could work together to maybe have a corridor between Guernsey and the Isle of Man where we've got no cases and therefore we could move backwards and forwards without fear of passing on the virus to anyone. And then we maybe look at other jurisdictions to see who is in a similar position to ourselves with no cases. That will be steps going forward, but we could be a number of months yet, so we're not talking weeks before the border opens. Obviously, if a new test comes along which enables us to test and know straight away whether you've got COVID-19 or not, that could be a game changer, and obviously a vaccine will be a game changer. But we totally realise that one of the key reasons, and I think I've always said there was the three reasons why we have done so well, is that A, the great Manx public worked hard to get us in this position. Two, that we tested and tested and tested and traced when we had, and we never stopped, and we carried on doing that in our hospital. And the other key one was closing our borders and implementing the 14-day quarantine. And your second question, Amanda.
Yes, you mentioned there the 14-day quarantine for those coming into the island. Jersey has introduced a testing policy for those who have just entered their borders, where people who are not required to self-isolate after getting a negative COVID-19 result, and then they're given 2 subsequent tests after this. Is there something we could see being introduced on the island to cut down that 14 days isolation?
Well, not at this moment in time. If you look at 4 countries, or 4 jurisdictions that everyone mentions, New Zealand, 14 days quarantine, Guernsey, 14 days quarantine, Isle of Man, 14 days quarantine, until the compassionate leave case in New Zealand. None of those 3 jurisdictions had COVID-19. Jersey, 2 cases yesterday. They've had 5 cases in the last couple of days. They have not enforced their 14 days quarantine. They've been trialling testing. You come on to Jersey, you'll be tested. then 3 days later you might be tested again with, you'll get an antigen test, then an antibody test, and then they'll do another test a few days later. But we all look at our own systems, what we feel will work, and our attitude is that the testing that we all currently do across the world only tells you whether you've got coronavirus or COVID-19 on the day of the test. So we know that you can have it for up to 14 days before you show signs of having it. So if I was in Westminster in a meeting and I was on the tube coming back and I caught COVID-19 from someone, I would go to the island's borders, be tested, and I would be negative. 3 days later, I could have another test, and I would still be showing up as negative. 8 days later, I could be tested and still shown up as negative, freely walking around society, but have it. And 2 days before you show symptoms, the evidence has shown that that's when you are at your most infectious. And therefore, I could cause a second wave unintentionally because I wouldn't know I had it. I'm not showing any signs, but I am infectious. And the tests will not pick that up at this moment. Now, if the tests change and you can pick it up from the day that you have the first test, it tells you, that could alter things. Now, I've heard some people say, well, you should do tests at the borders, but if you do tests at the borders and you're doing 14 days, if you, Amanda, came back to the Isle of Man and we tested you at the border and we found out you had COVID, what are we going to do with you? Well, we're going to send you home and tell you to quarantine for 14 days. Well, we're doing that anyway. So what is the point in taking our medics away from starting up our hospital procedures again or GP visits to go to the borders to carry out these tests for all the planes coming in and the boat journeys when all that's going to happen is that you're going to be made to quarantine for 14 days. Equally, if I give you a test and I tell you that you haven't got it and you go home and let's say you're day 10 into your isolation period and one of your best friends is having a birthday party and you want to go to it, you might think to yourself, well, I've not got it, I've had a test, I'm clear, I'll go to the party. And you could therefore infect all those friends at the party. So it can give a false sense of security that just clearly is not there. I don't know, David, if there's anything you'd like to add to that, because it is a key point.
Yeah, thank you, Chief Minister. The only thing I would add is that we did look at what Jersey's been doing. We look at all the different countries around the world and what they're doing, and it most certainly does not fit our risk profile. Jersey is undertaking testing and then allowing people out into the community. We don't feel that is safe for us. PCR testing is a point in time. There's the University of Bristol, I think it was, study that was released in the last couple of weeks that showed that up to 20% of PCR tests in relation to COVID-19 could actually return false negatives. We know, as the Chief Minister has said, in the early incubation period of the virus, that you may well be positive but not actually show up on a PCR test. There's some studies around the world actually saying that could be up to 10 days of the 14 days potential incubation period. So although PCR testing is the best form of test out there because it looks for the RNA of the virus, it is by no means an absolute solution. And as the Chief Minister quite rightly says, we shouldn't therefore be taking that as being our sole defence. The best defence we have is that 14 days. And I think the position we're in now shows well and truly in practice it's our best defence.
Yeah, I will just put a marker down, Amanda, so that this is not in tablets of stone. So let's say we see an absolute significant reduction in cases throughout the world and obviously especially our good friends in the Northwest and the United Kingdom. Then it might well be the case that we could go down to 8 days, do the test. The test will probably pick up about 80% of all those people with COVID-19, and that might then be decided to be a small enough risk to allow a change. So I'm not saying never that it will always be 14 days, but I'm just saying at this moment in time, with the number of cases around the world, etc., we feel the 14 days is the Isle of Man's best defence. And that's not just the Isle of Man's view. As I say, New Zealand, who were a couple of days behind us in being free of the illness, and our good friends in Guernsey, they share a similar view. So we think it's the right way to go, Amanda. Right, I've got Paul Moulton from MTTV. Paul, good afternoon.
Thank you. Good afternoon, Chief Minister. I don't know if you guys are aware, in the last hour, this major U-turn the UK government has announced, the UK government, about ditching the way its current coronavirus tracing and the app is being working. As you know, they were testing it in the Isle of Wight. They're now moving on to the technology that's being provided by Apple and Google, and this is being promoted as a much more privacy-focused event. And the government there intends to launch their app now in the autumn and say the product may not involve contact tracing at that point, but it could become the universal system. We've all got an iPhone, we've all got an Android phone, and this thing potentially could see the way forward. Do you agree, if you've had a chance to see that news?
Well, I've known about discussions on this for a while now. I think they tried this, Paul, in South Korea by having an app. Now, South Korea is one of those jurisdictions where people are pretty used to using their phone for the app, and it only tends to work if you have a high uptake, and they didn't get that high an uptake for it to work properly, and I think I don't know if they abandoned it after a while, but I know David will have been looking at this. So, David, would you like to give a more detailed view?
Yeah, I think we discussed this in our one-on-one interview on Monday, Paul, around apps.
David, but this is a brand new system. They've got rid of what they were doing because it wasn't working. It didn't have the uptake. This is going to be automatically on everyone's phone. I think that's the difference, yes?
Well, the concern, of course, my understanding is it's not automatic, is my understanding, because you can't, as far as I'm concerned, you can't legally download something without someone's permission onto their phone in that way, that it's still going to operate as an app. And one of the issues, as we discussed in our one-on-one interview on Monday around apps, is you need roughly around about a 40% take-up in the population. The Chief Minister mentioned South Korea. Another example, of course, is Singapore, where Singapore had the best take-up of an app, as far as I'm aware, and it got to 18%. Which is not enough to be able to do it. We've actually used physical contact tracing. And in fact, one of the interesting things that came out yesterday while discussions around the Isle of Wight is that people were more inclined to take the advice around self-isolation if they actually got it from a person than if a phone was instructing them to do it. That one of the bits that fed back from that experiment in the Isle of Wight is that people were more inclined to actually action something if someone had contacted them, spoken to them and talked them through it. So we have no intentions of switching that to anything like that at the moment.
I think the exciting bit is if everyone universally went to this, whatever system it's going to be, something that everyone agreed on, potentially, we have a much more easy way of finding out who's got what and tracing it back. So there's quite a bit of excitement. I would have thought there that things could move on, not maybe next week, maybe next month, but eventually.
If people trust the app, people do bring it onto their phone and it is widespread, then yes, it could be a very exciting development. But we have all seen stories over the last few years around how much people not just trust governments in terms of apps, but also trust the tech giants as well. So from my point of view, with my technical hat on, I'll be very interested to see just how widespread the app actually does go for both Apple and Google.
And in
we
the
can talk
interim
more
period,
about that on Sunday in our next one-to-one, David.
Yeah.
Thank you.
But if it's not broken, Paul, you don't fix it. So what's your next question?
We have a sort of end-of-term field now going on in these press conferences. I ran a poll the other day on Twitter, and 80% of people now think it's time to call it a day on these every day. I know next week it reduces to just 2, and then in future maybe just call them as and when needed. Do you think that's really possibly now, because we are in the situation where you have no new news, technically?
Well, no, I think, yes, we're going down to 2 a week. So we've started off at 7 on a regular basis. And then as we've got things more under control, we've been coming down. So I think answering the questions on a Wednesday that the public want answering, I think that will stay. We're going down, obviously, to Monday and Thursday. And let's see where this goes. If there's one thing that I've been bowled over is the phenomenal feedback from the public about how great they've really appreciated these briefings. And I know going forward, I always had my Chief Minister's press briefings on a Friday, and I'm thinking to myself, let's keep this going on a Thursday. Instead of doing it on a Friday going forward, we'll do it on a Thursday, 4 o'clock, and keep the format going. Because obviously, whilst there's been lots of down points to the COVID-19 outbreak, one of them has been the ability for government to communicate better with the people of the Isle of Man, and this system seems to work. and anything that we can do to get our messaging over to the public and relate better to the public has to be a good thing. So I would like to see this continue, but it will be in the hands of the public. We'll monitor the numbers that watch and the feedback we get. And
if I could just come in, Chief Minister. I noticed there, Paul, you said about it feeling like end of term. Just it's putting my cautious hat on, as we've seen with other countries around the world, I think it's actually more mid-term.
Yeah, we can't get carried away here. We could say this is the beginning of the end, but it's not the end of the beginning. But anyway, thank you, Paul.
Maybe we could all be in the same room in future as well. That'd be nice, because rather than talking to you down a pipe which constantly breaks up, we've never had the best communications. It'd be nice if we could all be in the same room again, yes?
Don't know, Paul. It depends who's doing the questions. Might like to keep you in another room, Paul. Swiftly moving on, we move on to Jess Ward from Isle of Man newspapers. Jess, nice to see you again.
Yes, you too, Chief Minister. I've got a question for Mr. Ashford, please.
Okay, David.
Hi, Jess.
Hello. So as we're making strides back to a sort of normality, I'm wondering what's happening in terms of Nobles Hospital. When can we expect that to be business as usual? And also what's happening in terms of patients? Are they still being directed to Ramsey Cottage Hospital for A&E and other services?
So we are slowly switching A&E fully back on. One thing I would say is up at Ramsey Cottage Hospital, we have the minor injuries unit, and the minor injuries unit has always been open to everyone around the island, not just people in the north of the island. So I would hope people will continue to use Ramsey Cottage Hospital regardless of where they may be based. In terms of clinics, we've started turning the clinics back on. They've obviously had to reprioritise their lists in terms of the lists that are built up. Some letters have already gone out from various clinics. I know we've already undertaken some capsule endoscopies. We're looking now around getting elective surgery switched on, which again will have to be done on a prioritisation basis. In terms of visiting at the hospital, obviously we updated our visitor policy 2 weeks ago. We will also be looking to review that in the next week in light of the current Ireland situation. But of course, we still do have to be cautious in medical settings because there is still a risk there, but we are looking to see what we can do to release things further.
Yeah, if I can add on that, the Ramsey District Cottage Hospital, I was down and seeing them all on Friday. They do a fantastic job down there, and their treatment was excellent. It's really helped Nobles concentrate on the COVID cases. And but well done to Ramsey District Cottage Hospital. I've always been a big supporter of it, and I'm delighted to see there's so many different procedures going on there now. We really have secured its future going forward long term, and it's a real jewel in our crown. And it's not just there for the people of the north, as the Minister said, it's for the whole of the island. And if there are small procedures, go down there. Right, your next question, Jess.
Yes, also for the Health Minister. So I just want to know what progress has been made in allowing visitors into adult social care facilities.
So the policies around adult social care are being reviewed. We have got some limited visiting now that is going on within the facilities. We have issued guidance to obviously the private care homes as well around visiting, and I know there's been some exceptionally good innovating in terms of visiting in some of the care homes out in the private sector. We're also reviewing that policy further again at the end of next week to see if we can release further some of the restrictions. But again, some of the most vulnerable people in society are in those environments, so we do have to take it step by step. I know it's been very frustrating for a lot of families, and there's been a lot of heartache around not being able to see their loved ones, and we ask them just to bear with us that really, really small little time longer while we get things sorted out and released. But we do have to do it in a controlled way within those settings. But the policy is being reviewed again next week, and hopefully I'll be able to make announcements at the end of next week around that.
Okay, thank you very much.
Okay, thanks very much, Jess. And we now move on to Leanne Cook from 3FM. Good afternoon, Leanne. Faster Mike.
Good afternoon, Chief Minister. Information has been posted on social media today by a couple who returned to the island on the Manannan yesterday. They stated there were no medical checks on anyone coming to the island, such as a basic temperature test. I'm just wondering if you could confirm the island's current procedure regarding checks at the sea terminal.
Right. Well, I don't know from a medical point of view, David, if you want to take that.
Yes, Leanne, when the repatriation first started, we were doing temperature checks at ports. I will share with you again my view on temperature checks and also a lot of the medical view as well. Temperature checks will only pick up, obviously, someone with a temperature. Now, that is one of the symptoms of COVID-19, but it will not pick up anyone in the incubation period. So as we start expanding our services, the usefulness of that temperature check has basically gone out the window. So we're not actually doing the temperature checks anymore because they will not pick up the vast majority of people we'd want them to pick up. And again, with people coming through and going into the 14 days isolation, as the Chief Minister mentioned around PCR testing at the border, it's exactly the same with temperature checking. Even if you picked someone up with temperature checking, the only thing you would do is either get them not to travel at all if it was picked up at the other end and self-isolate in the UK, or if it was picked up at the Isle of Man end, what are you going to do? You're going to ask them to self-isolate for 14 days, which they've got to do anyway.
It's also worth pointing out, Leanne, that if you take a paracetamol or ibuprofen, the list goes on, say 40 minutes before you go down to the boat, your temperature will reduce. So you're going to get a false... The key big gun that we have that works is that 14-day quarantine, that when you get off the boat, you go straight home, 14 days, that protects the Isle of Man. And as I said, we were funding a medic to go away to Heysham to do these tests, but A, it was taking a medic away from their frontline service and trying to get the island back up and running again. But B, what did it achieve? Because if we spot anything, we're going to ask you to quarantine for 14 days. We're already asking you to quarantine for 14 days. So I'm not saying that in the future, Leanne, as I mentioned before, that we won't do this sort of thing, but that would be because we might be reducing the 14 days down in the future because we feel that it's, with the number of cases around our neighbours, that it's a lot safer to do so. But the 14 days means that you don't really need to carry out the testing.
If I could just add at the end there, Chief Minister, in relation to public health and the clinical leadership group, their firm opinion is that in terms of testing should be undertaken where it adds value and it actually does something, it actually achieves something, and I'm a firm view of that as well as Minister. And in terms of the temperature check, it's not necessarily achieving anything.
Yeah.
Thank you. And my second question is a bit of a follow-up from that. The post that I'm talking about also stated that some people on the steam packet weren't wearing masks. I know that the steam packet themselves made it mandatory last week for people to do so. I don't know if this is your field, but do you know if this can be enforced or if there are any penalties for people who don't follow it?
Yeah, well, I'll start on that, and then maybe, David, you can finish it. I know that there are maritime rules that the steam packet have to follow, and obviously the UK, the British maritime rules stated that you should wear a mask. Now, obviously, we've always said we didn't feel that we would force people to wear a mask. We said if you feel you want to, that's fine, but it doesn't stop you from getting it. Now, obviously, people going from the Isle of Man to the UK are free of the virus, as we've just announced today. We've had no cases now for 28 days plus. But coming in, it might be a different kettle of fish. So we have always allowed the steam packet to be arm's length. It's not for the government to tell them what to do, as long as they follow our rules. So, David, if you might want to add anything to that.
Yeah, to clarify that this isn't a policy from Isle of Man Government or from the Department of Health. We are not mandating the use of masks on any form of transport. That includes the steam packet. It is a policy of the steam packet company, and my understanding is one of the reasons the steam packets brought it in is because of the rules in the UK now that actually state that when you're travelling on things like trains and public transport, you must wear the mask. That because people exiting from the steam packet into the UK will obviously potentially need to use a mask, they've mirrored that. But that's a matter for the steam packet company, as is any enforcement if they wish to do in relation to the boats. It's not something being mandated by Isle of Man Government or the Department of Health and Social Care.
Okay, thank you.
Thank you very much, Leanne. And last but not least, Josh Stokes from ITV. Good afternoon, Josh.
Good afternoon, Chief Minister. My first question to yourself, is there a concern now looking ahead that when the borders reopen, in whatever small-scale form that may be, that you may have to bring back social distancing, even just as a measure of caution?
I suppose we're looking at this all the time, Josh, really. It will depend on the infection rate elsewhere. How are other jurisdictions doing it? I think the quarantining will be with us for a while until we see much improved figures elsewhere. We will always have to keep ready to, on the back burner, our tests and our contact tracing. That really is important. I don't know if we would have to go back to 1 metre when we don't have any cases on the Isle of Man, but obviously we are, in the Council of Ministers today, we had a meeting on a document that I mentioned to you all earlier, that we are looking to show people what will happen if we have cases again on the Isle of Man, and the decisions and what people will have to comply with going forward. And I hope to get that out next week to all households on the Isle of Man and put it online. So it's an unknown. There are so many factors that will decide whether we'll have to go back to 1 metre in the future. But I don't see, if we've got no cases, having to go back to 1 metre. It will really depend on us getting it, if we get it again. And I sincerely hope we don't, but there will be a chance with having repatriation, having compassionate leave, that we may see cases, or allowing our people to go away, that they bring it back. But the 14-day quarantine protects us from it spreading. I don't know, David, do you want to give a further view?
I think you've summed it up very nicely, Chief Minister. Obviously, our wish would be not to go back to social distancing. We've managed to, as the Chief Minister said in his opening remarks, create a Manx bubble. We've got our society back to normal. There's various stages that our roadmaps will show that we will take if a second wave does hit us, and that will be dependent upon case numbers. But, border relaxation really depends, as the Chief Minister has said, on our near neighbours and what the situation is there. We're not going to make it a free-for-all if the situation is not improving elsewhere.
OK, and next, Josh.
Yeah, my second question to the Health Minister, please. In regards to dexamethasone, Health Minister, the UK is believed to have stockpiled the drug after it is seen to be a breakthrough treatment for the virus. Do we know what the stock levels are like in the Isle of Man for this, and if there are any plans to obtain more in preparation for a potential second wave?
Well, can I start, Josh, by saying congratulations on pronouncing dexamethasone correctly. You're one of the first journalists I've actually heard who's got it right. But in relation to that, we've been dealing with the Ministry of Justice. We have supplies on Ireland, but the Ministry of Justice has said we can use the UK supply as well to access it. Obviously, at the moment, we don't need to use it because the patients that would benefit from that are those that would be in an ICU situation, on a ventilator, or those who would be receiving oxygen therapy. But if we need to access that drug, then we can do so. I think it is important to stress, though, that in relation to this particular steroid, it's not a cure. It reduces the risks for people, but I wouldn't want people thinking that it's something that will automatically save a life. In terms of those on ventilators, it's been shown to reduce the risk of death from 40% to 28%, and for those on oxygen to reduce the risk of death from 25 to 20%. So it's a great drug to have, but it's not an overall cure.
Okay, thank you.
OK, well, thanks very much, Josh, and thank you all. I do have a couple of shout-outs this evening. And firstly, I have a request from our colleagues at the police to thank Steve Crow and Mr Mark Corlett from the Isle of Man Paramedic Service. During the pandemic, the police have been unable to secure dates for first aid training for new police officers with their existing training provider. And as a result of this, Steve and Mark stepped in to support the police to ensure that the training continued. Secondly, not really a shout-out, but I would like to wish all our young people a wonderful return to school on Monday. Thank you for joining us this evening. It has been another week of change, but I do hope that you can go out and enjoy the weekend. Let's hope the weather holds up. No one can say that there is no risk, but your incredible commitment and sacrifice has given us an island that is as safe as that it possibly can be. Keep on making responsible decisions for you and your loved ones. Have a great weekend and please stay safe. Thank you all very much.